And welcome back. It's a $4.4 billion industry that currently is under the oversight of the Food and Drug Administration.
But if some in Congress have their way, e-cigarettes will no longer be subject to the same regulations as cigarettes. Dave Delosier has been looking into this issue and joins us now with more. Dave?
Yeah, hey, Eric and Charlotte. You know, e-cigarettes are marketed as a safe alternative to tobacco products. At the UW Center for Tobacco Research and Intervention, they're conducting a study looking at individuals who smoke both cigarettes and vape. At this point, they say we simply don't know enough about the potential health risks to remove the FDA oversight.
Our center started looking at vaping about 4 years ago.
That study, being conducted by UW Center for Tobacco Research and Intervention, is looking at individuals who smoke both cigarettes and e-cigarettes.
Because we knew so very little about e-cigarettes, the question was, well, what is the combination of those two doing in terms of people's health and well-being?
A year ago, e-cigarettes were put under FDA oversight. They were categorized as tobacco products and subject to the same regulations as cigarettes.
I think it's a logical idea and one that has real compelling scientific and public health justifications.
But now, two proposals in Congress would change that. They would both remove e-cigarettes from FDA oversight. The argument is the research is prohibitively expensive and the process is too slow. One of the measures is a provision to the federal budget that must pass by midnight Friday to avert a government shutdown. Supporters of continued oversight point to contaminants in e-juices discovered by the FDA and safety concerns caused by exploding e-cigarettes.
And then there's the long-term, and at this point largely unknown effects. Are there unique health hazards associated with vaping?
Answers Dr. Jorenby says we need to know sooner than later.
In some senses, the public health community really felt burned by low-tar cigarettes, that these were presented in the 50s and early 60s as a boon to public health, and if anything, they turned out to be the polar opposite of that. So the sense of not knowing, of not asking the questions in the first place is not something that has a good track record.
Now, the proposed changes to e-cigarette regulations come at the same time that Congress is considering Scott Gottlieb to head the FDA. Gottlieb, a former physician and a deputy director of the FDA, is also a stockholder and former board member of a company that manufactures e-cigarettes. And Eric and Charlotte, as for the UW vaping study, it is still funded through one more year.
All right, Dave, thank you.
You bet.